In this video, we'll be going over Diabetes Mellitus Type 1 or Insulin Dependent Diabetes Mellitus by reviewing 5 questions. There will also be information on insulin. When the question pops up, I will read it to you, and then I'll pause to give you a chance to think of what your answer might be. Then we will look at the 4 options and discuss which one was best. If you want more information on this topic, you can usually find that in your endocrine section of your nursing resources. So let's get started. Question number 1. A 6-year-old was admitted to the hospital for complaints of abdominal pain, blurry vision, and enuresis, or bedwetting. Her parents have also noted she has been steadily losing weight. Lab results reveal a fasting blood sugar of 310. She is diagnosed with type 1 diabetes mellitus. Which statement by the nurse is correct? Is it number 1, your pancreas is not making insulin? Number 2, this diabetes is usually associated with obesity. Number 3, diabetes type 1 is caused by ingesting too much sugar. Number 4, you will take medications by mouth to control the high blood sugar. And the answer here is number 1. In the question, it is asking for a statement about diabetes mellitus type 1. So first of all, don't confuse the diabetes. There's another diabetes in nursing school that you learn called diabetes insipidus, and that has to do with the retainment of water. This one is defined by the retainment of sugar, increasing the blood glucose levels in the bloodstream. It also, some other information, it's also childhood onset, usually happens around age 10 or so. And the child cannot make insulin and therefore becomes dependent on insulin injections. So number 1 is correct. It's because the pancreas is not making insulin. Number 2, that was diabetes type 2. Number 3 is not the cause of either of the diabetes. And number 4, that one is for diabetes type 2, not type 1. So in the further learning, a little bit more information on the cause of type 1. It is when the insulin-producing beta cells in the islets of Langerhans in the pancreas are destroyed. For some reason, they are destroyed usually by a beta cell-specific autoimmune process. So the immune system is attacking its own pancreas. This could be due to genetics, or maybe there's some infection in there that creates inflammation. The immune system gets confused and attacks, again, the beta cells instead of attacking what's causing the infection. It could be created by a virus like the Coxsackie virus. And as far as the weight loss in the question, type 1 is commonly known for weight loss. The children's bloodstream is where the sugar and the calories are, and it never gets into the cell. So typically, the way we gain weight is the sugar goes into the cell, the glucose goes into the cell, and then whatever our cells aren't using for energy gets stored as fat. But since these children aren't even pushing the glucose into the cell, they typically don't gain weight. They're typically on the thinner side. Question number 2. A man is hospitalized for an infected foot ulcer and has been placed on fall precautions. At 11 a.m. his blood glucose is 460 milligrams per deciliter, and he has been up to the bathroom 7 times already. The best action for the nurse to take is the answer number 1, administer regular insulin according to the physician's sliding scale order. Number 2, notify the physician. Number 3, administer NPH insulin according to the standard or nutritional dose ordered. Number 4, since he's on fall precautions, make sure the client's urinal is close to the bed so he does not have to keep getting up. And the best action here is number 1. So in the question, there's quite a few things going on. The infected foot ulcer, the blood glucose level, the frequent urination, the fall precautions. So when we think of the best action, the first thing we should think about is, are we still assessing or ready to intervene? And in this case, we know his blood sugar, and we know he's getting up a lot to go to the bathroom, and those are signs of hyperglycemia. And so the best action here is to take care of the physical issue, and that is that blood glucose level. And therefore, my thought is to make sure to give him the insulin to bring that down. And you can see there's a sliding scale insulin example on the slide here. And greater than 400, it says we would give 12 units of insulin and call the physician. So don't pick to call the physician first, because the physician would say, well, did you give him the insulin? So you're going to pick to give the insulin first and then call the physician. So in the further learning, we want to make sure to know that sliding scale insulin has to be either rapid or regular. And that's the one we're going to use to cover him. We're not going to use the NPH because that won't cover him right now. That NPH is a longer acting and it takes 1 to 2 hours to start working. And then if you were pulled towards that fall precaution answer at all, just remember fall precautions are second in Maslow, not first. Fall precautions would go under that safety level. Physical, when it's appropriate, is always the best answer. And there was definitely something physically wrong here. We had to take care of that first. Question number 3. The nurse is teaching a client about diabetic management. The client asks the nurse, what is the hemoglobin A1C test? The most appropriate answer for the nurse to give is it number 1, the hemoglobin A1C is not a test for diabetes, it is a test for anemia. Number 2, the hemoglobin A1C is a blood test that measures glucose attached to the hemoglobin molecule over the last 7 days. Number 3, the hemoglobin A1C test is a urine test that measures glucose control over the last 3 months. Answer number 4, the hemoglobin A1C is a blood test that evaluates glycemic control over a 3-month period of time by measuring the glucose attached to the hemoglobin. And the answer here is number 4. This was just a knowledge question. What do you know about the hemoglobin A1C? And you just wanted to remember that it is a blood test that shows glycemic control over a 3-month period. And that leads you to answer number 4. So in the further learning, HbA1Cs should be less than 6.5 in adults, and in children it should be less than 11. If it's not, that HbA1c level above those numbers helps indicate that this client has diabetes, type 1 or type 2, it doesn't matter. So HbA1c is an important lab for diabetics. Question number 4. A client is receiving NPH insulin 20 units subcutaneously at 7 a.m. daily. At 1500 hours or 3 p.m., the nurse finds the client apparently asleep. How would the nurse know whether the client was having a hypoglycemic reaction? Is the answer number 1, feel the client in bed for dampness. Number 2, observe the client for Kussmaul respirations. Number 3, check the client's blood sugar. Number 4, check the client's level of consciousness. And the answer here is number 1. So in the question, the first thing I want to do is make sure we're really at a peak hour for the insulin working to determine if hypoglycemia is even in the picture. And it is, because NPH peaks anywhere from 4 to 10 hours after the dose. So that would mean it's peaking anywhere from 11 a.m. to 5 p.m. So 3 p.m., 1500 hours is right in the middle there. So we are possibly looking at a hypoglycemic reaction, but he's sleeping. So in what we know about hypoglycemic reactions, they're caused from taking too much insulin. And the way we know somebody's hypoglycemic is because they're sweating, they're diaphoretic, they might be nervous, tremors, confused, seizures, complain of headaches, have impaired vision, and yes, can lead to coma. So with this client though, do we want to wake him up to check his blood sugar, or is there any other way that we can kind of maybe have an idea that he could be going hypoglycemic here? And that's why number 1 is the answer. Feeling that bed for dampness is your first sign. If he just fell asleep, the last thing you want to do is like wake him up, or hey, are you alert, when he's totally fine. And number 2 is not for hypoglycemia. Kussmaul respirations are seen in type 1 diabetic ketoacidosis, which is a very high blood sugar situation. So the answer is number 1. And in the further learning, when answering questions, think about the situation they're putting you in also, and consider that when you're discussing the best way to assess the situation in the moment. So the ultimate question is, did we really need to wake him up, or was checking the bed for dampness an okay first step? And since sweating is one of the first signs of hypoglycemia, his bed would be sweaty. Question number 5. A client with diabetes receives a combination of regular and NPH insulin at 0700 hours. The nurse teaches the client to be alert for signs of hypoglycemia at... Is the answer number 1, 12 to 1 or 1200 to 1300 hours? Number 2, 9 a.m. to 5 p.m. or 0900 to 1700 hours? Number 3, 10 to 10 p.m., 10 o'clock to 2200 hours, or 8 a.m. to 11 a.m., 0800 to 1100 hours. And the answer here is number 2. So in the question, they got both a short-acting and a longer-acting regular NPH, and so hypoglycemia starts at the peak times. So we had to remember that the peak insulin times are the highest risk for hypoglycemic reactions. Regular insulin starts peaking in 2 hours, usually 2 to 3 hours, and NPH peaks in 4 to 10 hours. So we have to accommodate for both types of insulin. So the regular will start peaking, he got it at 7, so the regular will start peaking 2 hours from there, which is 9. So I'm looking for an answer that says 9 a.m. And then it's going to continue peaking because the NPH is involved for 10 hours post-dose. So 10 hours post 7 o'clock would be 5 p.m. So he could be having hypoglycemia anywhere between once the peak starts to the peak stops. So 9 a.m. to 5 p.m. Number 2 is your answer. And I like this question because in the further learning, this is a great example of when you're given information, like sometimes you're just given the insulin charts with the onset, peak, and duration. Start asking yourself, why does the nurse need to know these numbers? It's not just about memorization, it's about understanding the purpose. And so with that chart, the onset is telling you as the nurse how quickly the patient might need to eat, especially for the rapid and the short acting. They need to have food because if you give them insulin and they haven't had their food, it could cause hypoglycemia. The peak times are for a question like this. This is a great example of a question involving those peak times because that's when the nurse needs to monitor for hypoglycemic reactions. They're not just going to ask you what are the peak times. We need to apply our knowledge in situations. And then the duration on that insulin chart helps the nurse know how often these insulins are dosed. For example, rapid and regular usually have a duration of around like 4 or 6 hours or so that those insulins can be given like 4 times a day. NPH, the duration is 12 hours, so that tells you that insulin is given BID. And the really long-acting insulins, those durations are 24 hours, so that tells you that's the Q-day insulin. So as you're studying, it's just always a great idea to say, why do I need to know this information? How would a nurse apply this at work? Not just memorize what they give you. Start asking why. So I hope you enjoyed going over diabetes type 1, learning through questions, critically thinking, applying your knowledge to possibly real-life situations. If you like this video, we have more like this. Please like it, share it, subscribe to our channel. You can always find us at sciencestrategies.com.